Hi, Dr. Pam here with Lakeside Holistic Health. Today I wanted to talk to you about bioidentical hormones and what they are and how they can be used. Bioidentical hormones are plant-based hormones, and these hormones are identical to human estrogen and progesterone. In the past, women were given things like Premarin or Provera to help with menopausal symptoms. Premarin is derived from horse urine, and therefore it is not identical to human estrogen. Many women experience side effects from this specific type of estrogen. Provera is a progestin, which means it is not bioidentical progesterone. And again, many women don't feel as well on these synthetic versions of that are not bioidentical progesterone. So one of the things that I do for women when they're having menopausal symptoms are bioidentical hormones. But what I like to emphasize to women is that we also have to build a strong foundation. And these bioidentical hormones are a tool that we can use to help you to feel comfortable, but you really have to focus on strong adrenals, good nutrition, keeping everything else less inflamed in your body. And one of the things that I have seen happen is that sometimes I have women come in that have had a hysterectomy, and the reason they had it is because they had severe endometriosis or uterine fibroids. And then they are starting to experience severe menopausal symptoms, so they need some type of estrogen to make them to feel comfortable. When I've given them estrogen or progesterone, sometimes I'm getting a phone call saying, I have all the symptoms that I used to experience when I had a uterus. And this is because you never fix the underlying problem. And the problem has to do with how you're metabolizing estrogen. Some of the different tests that we now have available, we can see how your body is metabolizing estrogen. And some of these different pathways actually set it up to be more toxic than what it was to start with. And that can increase your risk for breast cancer and uterine cancer. There are different genetic SNPs. And these SNPs are your variants in how you react to your environment. And some of these SNPs allow you to not break down estrogen very well. And we have a lot of different what are called xenoestrogens in our environment, and those are things that mimic estrogen along with hormones and things that are put in our food. So having this exposure to a lot of external estrogen along with trying to give somebody, even though it's a bioidentical estrogen, they may not be able to detoxify it and break it down correctly from their system. So what we want to do is build a strong foundation for that person so that way they're able to utilize those hormones and we use the least amount possible. Dr. Pam from Lakeside Holistic Health, and thank you for listening.